Gaurav Mahagud Kahirlach. As we wrap up here this evening, or this morning, I'm just going to speak about two different things, and one of them is in relation to the housebound individuals that Deputy Connolly has just raised. And I just want to give, I suppose, an update in relation to how it is actually working. So GP practices receive guidance from the HSE home vaccination programme for the over 70s who are housebound. So they had the responsibility of referring eligible patients who required this service. We assumed that there would be approximately 1,500 people in this group, but there are actually 2,000 people aged over 70 years and older that have been referred for home vaccination. The housebound vaccination programme started on the 12th of March, and by the end of this week, so this is the second week of it, 740 people will be vaccinated. So dose 1 of the vaccination programme has been completed in Dublin City and County, in the North East and the Midlands. So vaccination has commenced in the South East for this week. So by the end of this week, we will have 740 people. In the next 2 weeks then, the programme will expand to the west and to the south of the country. All first doses are expected to be administered across the country in early April. And can I just say how it was determined? So it is a huge logistical challenge, and the decision was made that the National Ambulance Service would roll out these vaccines. So there are dedicated regional teams in each area that are rolling out the vaccine. And I want to thank the National Ambulance Service, because this is obviously a slower process than when somebody attends a clinic or a mass vaccination centre. It is much slower because these people are very vulnerable and they are housebound. But can I just say, and I have said it so many times, nobody will be left behind, and we are getting through the first doses. So just to reiterate, 740 by the end of this week of the 2,000. And Cahir, I just want to move on then just to talk a little bit about nursing homes, if that's okay. The prioritisation of those in nursing homes and long-term residential care facilities has proven to be the right approach, as those most at risk to a bad outcome of serious illness or death from COVID. And I know there has been several calls here today in relation to how prioritisation is determined, but I fervently believe, and I know all my colleagues do, that prioritisation for those most at risk of COVID has to be based on clear medical and clinician guidelines, and it can never be determined by politicians. So as a result of a very successful rollout of the vaccine in nursing homes, 99% of residents and over 90% of staff have been vaccinated. So as a result, visitation resumed on Monday of this week, the 22nd, in relation to those living in nursing homes, which was really, really welcome. So residents may be facilitated to receive 2 visits per week on general compassionate grounds. So that means that they are entitled to have a visit. And this is possible following 2 weeks after full vaccination. So that's the norm in nursing homes. There is no requirement to limit visits to less than 1 hour, and I want to state that categorically. And this is an increase from the current guidelines, where 1 visit per resident is facilitated every 2 weeks previously. Also, the same family members do not have to be those listed to visit. So say, for example, there's a family with their mum or dad in a nursing home, and there could be 6 siblings. It doesn't mean that the same 2 people have to visit every week. They can rotate. I am aware of some nursing homes who are taking a cautious approach, and they are saying that it has to be the same 2 dedicated family members, but that is not the case. And there is no obligation that the same 2 family members have to visit weekly. I am asking all nursing homes to support and implement these new visitation guidelines. These guidelines are in line with existing public health guidance and advice, and vigilance on the general infection prevention measures must be maintained. Now, the guidance will be kept under continuing review as new evidence and data emerges. And just another clarification is, we have taken a cautious approach in relation to nursing homes. The pandemic bore down really, really hard, and 88% of those we have lost have been aged over 70, and over half of those we have lost have died in the nursing home sector. So I just want to say that we still have to take a cautious approach. So today we still have 68 open outbreaks of COVID in the nursing homes, but they are not of the scale, or they are not of the amount of people that we would have previously, and a lot of these cases are now asymptomatic. But just, I suppose, on a good note, just to show how the vaccine programme in nursing homes and in long-term residential care facilities has been so successful. Last week, this was round 9 of serial testing. Of the 40,423 people that were tested, we only had 81 cases detected of COVID, 0.20%. So that is really a positive news for those that have worked so hard in that sector for the last 12 months. And I just want to compliment everyone who has worked in that sector. There has been very, very difficult, traumatic days. There has been lonely days, and it has been really, really tough on residents, on families and on those working there. But I do think when we see how successful the vaccine programme has been in nursing homes, it just shows that there is light at the end of the tunnel. Garv Mahagut.
Thanks.